Hello, my name is Angelia Mulrooney, and this is my Week 7 mental illness presentation. I decided to write about anxiety. When an anxiety-provoking stimulus is present, there becomes an increased activation in the amygdala area of the brain. Symptoms of anxiety disorders usually consist of unrealistic, excessive, and long-lasting worry, motor tension, restlessness, irritability, difficulty sleeping, and hypervigilance. Typical methods of treatment are taking benzodiazepines, SSRIs, and attending cognitive behavioral therapy. Benzodiazepines can be taken as needed to help with symptoms such as panic attacks, whereas SSRIs increase serotonin levels in the brain, so they need to be taken on a more regular daily basis. And cognitive behavioral therapy focuses on challenging a person's unhealthy behaviors and thoughts and helps them develop better coping strategies. I put this sentence in bold because I thought it was pretty important. An anxiety disorder is a mental health disorder characterized by feelings of worry, anxiousness, or fear, which is strong enough to interfere with one's daily activities. It's normal to have anxiety, especially as a response to stress, but it becomes a disorder when it interferes with your daily life. When anxiety is heightened, it can express itself in the form of other disorders such as post-traumatic stress disorder and obsessive compulsive disorder. I decided to focus on obsessive compulsive disorder, which is a mental health disorder which consists of recurrent obsessions and compulsions. Obsessions are recurring, upsetting thoughts which are persistent, intrusive, or inappropriate and cause anxiety. Compulsions are ritualistic and repetitive acts that the sufferers feel driven to perform in order to alleviate anxiety. I learned in the textbook that there's actually surgery that could be performed to help alleviate symptoms of OCD. Psychosurgery is 84% successful. And I learned in the textbook that the surgery itself consists of bilateral lesions in the lower orbitofrontal cortex and anterior cingulate area. I attached the diagram from the textbook where it shows an example of how the brain reacts to someone that overly worries and obsesses. The example that was given in the textbook is someone that has OCD and is worried about their car being left unlocked in the parking lot. So it goes through the steps of excessive worry was prompted in the orbitofrontal cortex, which results in projected emotion in the amygdala, which stimulates terror, and then which also activates the caudate nucleus, which prompts action, like going to check on whatever is worrying him. So he goes out to the car to check on it, and then the nucleus accumbens gives person the pleasure reward of ensuring that everything is okay. So that was an example that I thought was pretty good. I myself have OCD. I have a different form of it. I have dermatillomania, which is also referred to as chronic skin picking disorder, So I could relate to that example, but in a different way. For me, it would be more like I would have to check an imperfection on my skin by usually scanning with my fingers or running to a mirror to check. And then I get that intense pleasure from the reward system once I feel like I have accomplished or fixed the problem. So dermatillomania is a mental illness within the obsessive compulsive disorder spectrum. It is characterized by repeated picking at one's own skin, which results in skin lesions, infection, scarring, premature aging, and causes significant disruption in one's life. Individuals may pick at healthy skin, minor skin irregularities, lesions, or scabs. This disorder is usually chronic with periods of remission alternating with periods of greater symptom intensity. If left untreated, skin picking behaviors may come and go for weeks, months, or years at a time. It is common for individuals with this disorder to spend significant amounts of time, sometimes even several hours a day, on their picking behavior, which also includes overly grooming and overly cleaning the skin, overly washing the face. Skin picking is a body-focused repetitive behavior that typically begins during adolescence, commonly coinciding with puberty around ages 13 to 15, but may also occur among younger children under the age of 10. This disorder affects approximately 1.4 of American adults and is experienced by women more often than men, but I think a big part of that has to do with people being embarrassed and not seeking help. So I feel like a lot of people are not represented in that percentage, but skin picking is considered a body-focused repetitive behavior because it's repetitive, direct body-to-body contact, which unintentionally causes physical harm to the body. The urge to pick at one's skin is a compulsion, and the inability to stop picking because the feeling of euphoria is similar to addiction. Picking results in the release of endorphins, which obtains feelings of calmness and pain relief. So I found this image of the brain of someone with OCD, and I thought it was really interesting, especially because we learned about functional MRIs in class, and I found the image online. The image shows that brains of OCD patients get stuck in a loop of wrongness, and that patients can't stop even though they know that they should. Decreased responsiveness in the dorsolateral prefrontal cortex and caudate nucleus was found during functional MRI executive planning tasks in people with OCD. It shows significant differences in activity in regions involving error processing and inhibitory control. I have personally suffered with the debilitating mental illness of dermatillomania since I was in middle school. It is debilitating because after bad picking episodes, I experience lots of shame, which leads to panic attacks. And after doing damage to my face, especially, I will isolate myself from friends and family. I have also skipped school and work due to my chronic skin picking. Anxiety prompts obsessive worrying, which is mediated by the orbitofrontal cortex. The worry response expands to the relevant limbic structures, including the cingulate cortex and amygdala, which result in full-blown terror. The fear response prompts a compensatory response mediated by the striatum's caudate nucleus. This causes the person to start the checking behavior. Once everything has been checked, the person feels satisfaction, which is mediated through the nucleus accumbens circuitry, which diminishes the feeling of fear, even if it's only temporary relief. Picking also stimulates the reward system. In conclusion, I talked about mental illness, more specifically anxiety disorder, and how OCD is considered to be a part of anxiety, and how dermatillomania, which is something that I suffer with, is on the OCD spectrum. And I decided to focus on this topic because it is a very personal topic for me. I feel like dermatillomania lacks awareness, which has caused me to go undiagnosed for most of my life. So I feel passionate about bringing awareness so that people don't have to suffer in silence. I also think that openly talking about it instead of keeping it a secret has also helped my journey and has helped me progress and get better. Thank you.